Hello students, Dr. V here. I wanted to give you some extra information about Module 11, which is Chapter 25, which deals with anxiety disorders. When we think about anxiety, there are many different things to consider. Let's review the basics from your PowerPoint. Anxiety is the apprehension, uneasiness, uncertainty, or dread from a real or perceived threat. Fear, however, is a reaction to a specific danger. An example of fear would be a dog rushing at you and barking loudly. You become very fearful. Normal anxiety, however, is what we encounter that is necessary for our survival. There are many different types of anxiety disorders, and according to the APA, the term anxiety refers to several disorders, them being separation anxiety disorders, panic disorders, agoraphobia, which means you're afraid to leave your house, specific phobias, maybe spiders, snakes, social anxiety disorder or other social phobias, generalized anxiety disorders, separation anxiety disorders, developmentally inappropriate levels of concern over being away from a significant other. People can even have panic attacks. People have excessive anxiety about being a fear of places, such as like heights or being in an elevator. Severe anxiety or fear provoked exposures to a social or performance situation can also negatively impact people. That can become a disorder. Anxiety disorders can come from excessive worry that lasts for months. We also have substance induced anxiety disorders. So people are taking medications, whether they're legal or illegal, that causes them anxiety. And then we have anxiety that's due to a medical condition that the patient has no control over. Your PowerPoint and presentations give you an excellent description of these anxiety disorders. So please review that and study from that. I just a little bit about Hildegard Peplau. We've already learned a little about her. However, you must remember and know that Hildegard Peplau had a profound role in shaping the specialty of psychiatric mental health nursing. She identified anxiety as one of the most important concepts and developed an anxiety model that consists of four levels of anxiety. They're mild, moderate, severe, and panic. The boundaries between these levels are not distinct and they do overlap. Some of the behaviors and characteristics of the individuals experiencing anxiety can be very, very similar. Identification of a specific level of anxiety is essential, though, because the interventions that we do as nurses are based on the degree of the patient's level of anxiety. So let's discuss those four levels. Mild anxiety occurs every day. It occurs in the normal experience of everyday living and allows an individual to perceive reality in very, very sharp focus. A person experiencing a mild level of anxiety sees, hears, and grasps information more clearly, and their problem solving abilities become more effective. Physical symptoms may include a slight discomfort, a restlessness, an irritability, mild tension, such as nail biting, foot or finger tapping, or fidgeting. Interventions to help people with mild anxiety are to help them identify their anxiety. Use of nonverbal language will demonstrate an interest in them and encourage the client to talk about his feelings. We'll focus on the client's concerns, avoid closing off important avenues of communication for the client, and we ask questions for clarification. A little bit more about mild anxiety, if you can remember it this way. Mild anxiety is something that we all have. Mild anxiety is the thing that makes you get up in the morning, it's the thing that makes you study, and it's the thing that makes you eat. So if you think about somebody, we have a very bit large population of 35 something males that live on in their parents' basements and play video games. They're not really probably experiencing any mild anxiety because something is being taken care for them. They don't generally feel hunger because someone's waiting on them. So they really need some mild anxiety in their life, like getting up and going to work, paying their bills, those types of things. So remember, mild anxiety is the things that make us do what we need to do. They put us a little bit under our comforts, out of our comfort zone, so that we improve and we do something for ourselves. Another example is when that alarm clock goes off in the morning. It causes a little bit of mild anxiety. You wake up, you startle, and then you're like, okay, I have to get started for the day. Okay, so moving on to moderate. Moderate anxiety means the person is experiencing moderate anxiety and he sees, hears, and grasps less information and may demonstrate selective inattention. So these are things that in the environment that are happening around them that they might not pay attention to at all. The ability to think clearly becomes hampered with moderate anxiety, but learning and problem solving can still take place, but it's not at its optimal level. So if we think about test anxiety, some people get very anxious when they're taking a test, and that forces them to study more. That would be your mild anxiety. If it's moderate, they're having difficulty concentrating while taking the test. They're paralyzed, they're not thinking clearly. What happens is that our sympathetic nervous system begins to kick in when we have moderate anxiety. And so that individual may experiencing tension, a pounding heart, increased pulse, and a respiratory rate. They may even perspire or have some mild somatic symptoms like tummy ache, headache, wanting to go to the bathroom all the time. They may have voice tremors and they may be shaking a little bit. Mild or moderate levels of anxiety can be constructive because anxiety may be a signal that something in the person's life needs attention to or dangerous. The interventions we use for moderate anxiety, though, include helping the client to identify the thoughts or feelings before the onset of anxiety. So, to identifying what the problem is before, encourage problem solving with the client, explore behaviors that have worked to relieve anxiety in the past, and provide an outlet for working off excess energy. When I have a patient suffering from an anxiety disorder, and that's more severe, or they're moderate to severe, we actually talk about what helps calm them down. Is there a certain band they like to listen to? Do they like to exercise? What things do they do that they know will work? So when they're in a situation and they're feeling out of control, we have something to rely on to help them that we know has worked for them in the past. All right, so moving on to severe anxiety. When somebody has severe anxiety, their perceptual field is greatly reduced. They're not thinking clearly, they're not seeing things clearly. They may have a lot of physical symptoms, high blood pressure, high pulse rate, all of those types of things. They're very scattered and not functioning well in their environment anymore. Their learning and problem solving are not possible at this level. So somebody who is trying to take an exam with a severe anxiety disorder would do very, very poorly on it. Learning and problem solving aren't possible, like I said, and they present as very dazed and confused. They probably aren't able to relieve their anxiety at this point. They may need medications to do so to help calm them down, and their behavior may be very automatic and they aren't really paying attention to anything in their environment. A lot of somatic symptoms may creep up too. They may state they have a headache, they're nauseous, they're dizzy, they have diarrhea, they can't sleep, and those often increase and get worse over time. We've even seen patients that are trembling, their heart is pounding out of their chest, and they may experience hyperventilation, and they may feel like an impending sense of doom or dread. Now, severe anxiety should not be intertwined with panic disorder. Panic is very, very extreme, and the patient is not functioning at all anymore. They're not able to focus, and they actually may be emotionally paralyzed. Can't deal with anything. They shut down. They may hallucinate, and they may not even be able to respond. They may not talk. They may have psychomotor agitation. They're running, they're panicking, they're not able to handle anything, and they may actually feel like they're having a heart attack. The feelings of terror present during a panic attack are so severe that normal functioning is suspended. The perceptual field is limited, and they're misinterpreting what's going on around them. They often feel like they're losing their minds, or they actually are having a stroke or a heart attack, when in reality it's panic. Uncomfortable physical symptoms such as palpitations, chest pain, breathing difficulties, nausea, feelings of choking, chills, hot flashes may occur. The thing about panic attacks you need to remember is that they often come out of the blue. They're very, very sudden, and they're not predictable. Now, over time, if someone is suffering from a panic disorder, they may be able to work with a therapist and figure out what triggers a panic disorder. But most people, right, especially in the beginning, do not realize they're having a panic disorder. They really believe they're dying, they're having a heart attack, those types of things. So when we are dealing with these patients, with severe anxiety or panic attacks, there's things we really need to make sure we're doing. One of those is maintain a very calm manner about yourself. If you are getting agitated and worried and unsure of what's going on, that's going to feed the patient to feel like they aren't doing well either. You use clear and simple statements, use a very low pitched voice and speak very slowly, reinforce reality of their distortions if there are any, attend to their physical and safety needs. You may have to place a physical limit on them if they're pacing and walking around. You may have to ask them to sit down and provide them medications, provide them opportunities for exercise if need be. But if they're constantly pacing, if somebody's constantly pacing, we need to worry about their nutrition and hydration status. So that's where we would offer them small bits of food and things to drink so that they continue to stay hydrated so they do not collapse. Again, sometimes we use medications and often even seclusion. All right. Attached to this document is a second document that I'm placing in the course that's labeled defense mechanisms. All of the defense mechanisms that you need to know are labeled there with their definition, and they also have examples so that you can learn them. I would highly recommend that you review the document and the video. And the video that I posted last week under stress also talked about defense mechanisms. If you have any questions, please let me know. Thanks.